Okay, thank you for joining everyone this morning or afternoon, depending on where you're dialing in from. We're really excited to host the next in our webinar series at Soul Mental Health. We're going to have Dr. S, our medical director in Texas, presenting on a topic that is really important to us here at Soul, and we know is important to clinicians all over the country, which is wellness and resilience. So I will hand it over to Ori to take over from here. If anyone has questions, feel free to drop them into the Q&A over the course of the presentation, and then we will curate a Q&A session at the end with the time we have left over, and make sure we get to everybody's questions. Thanks. Ori, I'll hand it over to you.
Hello, everybody. Good afternoon. And I'm very grateful to be able to give this presentation. Just preparing for it was really, how would I say, it really gave me pleasure to prepare for it. And I learned a lot just preparing for it. So here at Soul Mental Health, we believe in clinician wellness and resilience. We want to foster it. And we just thought it would be good to share it with the community. Heal thyself while healing others. Excuse me. Something happened with my slides. Okay. Yeah. So let's find the balance together, one step at a time. The purpose of this slideshow, of Soul, sorry, is to help individuals find healing and balance. And also our vision is to help individuals find peace of mind. And our mission is to serve our communities with through mental health and through an integrated approach. Our agenda today, as you can see, is clinician wellness, challenges faced by clinicians, tools, tips and tricks, and resources that we're going to share to help to combat burnout and compassion fatigue. So why do these things matter? Why do we have to talk about these things? It's important to talk about clinician wellness and resilience because they are critical for providing healthcare, quality healthcare to our patients. Research has shown that clinician burnout is associated with decreased patient satisfaction, increased medical errors, higher health costs. And we know that when there are a lot of medical errors, then there's a risk of higher malpractice insurance and lawsuits and things like that. Also, when clinicians are burnt out, then they will be higher job turnovers, and it becomes a vicious cycle because those who are left will be burnt out, and then it goes on and on. So it's important for overall career satisfaction and longevity. The benefits of prioritizing clinician wellness is, in fact, we cannot overemphasize it because it benefits your own physical and mental health. And just the way that we want our patients to do well, we need to take care of ourselves as well. Definitions of burnout. So burnout is a state of emotional, mental, and physical exhaustion caused by excessive and prolonged stress, often resulting from professional responsibilities. For example, when you have a lot of admin work to do on top of your clinical work. And when it comes to clinicians, very few common signs of burnout include feeling emotionally drained, low job satisfaction, and decreased work performance. You find yourself also becoming very irritable. Now, symptoms of compassion fatigue, similar, the triggers are similar. It's also a state of physical, emotional, and mental exhaustion, but it's triggered more by the exposure to traumatic events that you experience when you are treating other people, when you're seeing their suffering. So clinicians exposed to traumatic events such as death, illness, severe injury over a period of time, a long period of time, may experience its symptoms. They can start feeling numb or detached, become irritable, have poor sleep. So it's very similar to the symptoms of PTSD that we can see in our patients. And so again, the impact on clinicians is that they become more, less empathic towards their patients. They're more likely to make errors, and it's more difficult for them to establish rapport with patients or create a positive therapeutic alliance. So we all know the challenges of being a clinician. Just working in the healthcare is a high stress level environment, especially in like emergency rooms, and then even in mental health. But every form of medicine or mental health, healthcare can and has the risk of being a high stress level job. We have to communicate not only with patients, but also with their family members. We have to navigate complex healthcare systems, also dealing with life and death situations. Clinicians often experience emotional exhaustion due to all these things we mentioned. And then we had talked about the secondary trauma, the risk of secondary trauma, where you are exposed to traumatic events of others. You are witnessing the violence, or you're witnessing the effect of the violence, accidents, natural disasters that other people have been through, and you're trying to treat them. So that's where the secondary trauma exposure comes in. Now, going to the good part where we're talking about how to mitigate burnout and compassion fatigue. So resilience is a very, very important tool that we can develop that can help us with this. It is defined by the American Psychiatric Association as the capacity to bounce back, to withstand hardship, and to repair oneself. Just so think about a rubber band, or some of those squishy toys that we give the kids. So having that capacity to bounce back. It can be characterized as positive adaptation in the face of stress or disruptive change. And there are a number of factors. Some people have, just that optimistic overview or temperament. So some people have internal attributes that already help them. And then there are external attributes such as modeling or trauma. And then the skills such as problem solving skills, finding meaning or purpose in your job, practicing mindfulness, and we'll talk more about this. So examples of things that we can do to prevent burnout and compassion fatigue: setting healthy boundaries. So an example is knowing what is acceptable and what's not acceptable in terms of your workload and emotional engagement with patients, respectfully communicating those boundaries with your teammates. So for example, one of the boundaries I set for myself when I started working was that I would only work within my work hours. So for example, 8 to 5, I'll make sure I do my best, work as hard as I can within those hours. And then once it's time to go home, I will shut down my computer. Now that we have a lot of working from home, hybrid, it becomes blurred between time and at home. So you need to be very conscious about setting those boundaries and setting your work-life balance. Self-care is very important in terms of exercise, healthy eating, and engaging yourself in hobbies that bring you joy. Seeking guidance, feedback, and emotional support from your colleagues, supervisors, and mentors. Mindfulness techniques. So mindfulness is something that is becoming very important now, that we're recommending to everybody. Not only our patients, but we ourselves need to learn mindfulness. And there's an app, a free app that was developed by the VA, and you can download it to your phones. It's called the Mindfulness Coach, and you can learn mindfulness techniques from there. Finding meaning in our work. So there is a strong association between feeling a sense of calling in your work and well-being. the APA reported this survey that they did on almost 1,500 primary care physicians and 512 psychiatrists, and 42% agreed that medicine is a calling. And those who reported that it was a calling experienced higher levels of career satisfaction, improved resilience, and that helped them mitigate burnout. So what does this mean to us? Excuse me. It means that we need to reflect on the parts of our job that we really enjoy and seek to optimize, maximize those parts of our jobs that we like. Also, it needs to inform you when you're looking for a job, what your priorities are, what things that you want to see in your job that will help you promote that work-life balance. Can resilience be built? Yes, it can. So even though there are some people who are more optimistic than others, some of us actually need to make a concerted effort to develop resilience. And this is how you can do it. We talked about maintaining physical health, not only exercise and a good diet, also avoiding alcohol, recreational drugs, and smoking. If you're not a member of a gym, trying to join a gym, you can also engage in exercise videos. There's so many of them these days. And then we talked about stress reduction techniques. We're going to talk more about those. And then practical tips like setting the boundaries, taking breaks, keeping intentional time away from work, using your vacation time. And this is again reiterating some of the things we said, some of the exercises that you can do. For example, taking steps instead of the elevator during rounding, finding exercises that you can do at your desk while writing notes. There are like YouTube videos you can easily find on stretch exercises you can do in your office. You can also go on walks during your break time. Healthy snack options, you can make sure you find. There are so many of them now that you can get that have 100 calories or 200 calories, and they're in small containers you can just keep in your purse for when you need them. So we all know the importance of exercise. I don't want to be preaching. I know I'm preaching to the choir here. All right, we're talking about establishing a bedtime routine. So having adequate sleep and good sleep quality. Examples of routines: your winding down time before you go to bed, like reading, shower, and then practicing the muscle relaxation. We'll talk about that later. I also would like to talk about the CBTI, which stands for Cognitive Behavioral Therapy for Insomnia. There's a free app also developed by the VA that you can download, and it teaches many good tools to help you with your sleep. It also teaches mindfulness as well. So it's a great resource to have and also to recommend to patients, of course. Limiting bedtime screen time. We know about this. It reduces the blue light that can affect your sleep. And also making sure that your bedroom the environment is comfortable for you. Okay, so mindfulness. What is mindfulness? It's when you focus your attention on the present moment and accept it without judgment. So just being in the moment. It can help reduce stress and improve overall mental health. So try starting your day with 5 to 10 minutes of mindful meditation, prayer, or stretching. One thing I recommend is a gratitude exercise. For example, at the start of your day, you can think of 3 things to be grateful for. For example, I'll give an example. In the morning, I'm grateful to be alive. I'm grateful that I have a family, a loving family. I'm grateful that I have a job that I can go to. And then at the end of the day, even if it has been a stressful day or a long day, there are many things you can think of. For example, I can be grateful that my patient showed up on time. I was able to complete my admin tasks, and I still ended my day at 5 o'clock. I was able to call, like if I had a crisis, I was able to call the crisis line. I got a good response from the crisis line. If I saw patients remotely, I can be grateful that there were minimal glitches in the connection. Everything went well. The patient signed in on time, everything. So there are different things that you can find little things to be grateful for, and it really does reduce your stress at the end of the day. I have another one I want to say here. I can be grateful for my boss, my supportive boss, who helped me when I was having a tough time. So there are different things that you can be grateful for. Deep breathing exercises. The example here is box breathing, and there are different types, but the one I like is the one you use for just 4 seconds. And so you sit down in a comfortable position, and you take in a deep breath, making sure your chest and your stomach are rising. You hold it for 4 seconds. You can say, count in your head. And then you take it in for 4 seconds. You breathe. You hold it for 4 seconds, and then you breathe out for 4 seconds, and then you repeat it. So this is a very easy one that you can do. And I'm going to do it with you, and if we could do it together. So let's sit down comfortably. Okay, just taking a normal breath first. Okay, now let's take it in for 4 seconds. Hold it for 4. Breathe out for 4. And you can see it just calms you. So you can do it like 2 or 3 times or for 30 seconds or till you feel calm. And it's a great way for reducing your stress when you're overwhelmed. For example, you're at work and there's so many tasks being thrown at you. And just take a step back and you can do this box breathing. And it really helps just center you. Progressive muscle relaxation is another one. That's really good for when you're trying to relax before bed. And that involves tensing and relaxing your muscles systematically. So you can start from either your head or your feet. Another one is body scanning. So you just do one at a time. And when you're tensing, you're taking in a deep breath. And when you're relaxing your muscles, you're breathing out. So that's another good one. So again, just to reiterate what we said, if you're having a stressful day, take a step back, try one of these techniques that we talked about, regain your perspective by diagnosing the root cause of your stress and mapping out logical solutions to walk through them. For example, you can create a priority list. So you make a list of the things that you need to do that day. You determine which ones must be attended to. You determine which ones can be delegated or put to the next day. And if this continues to be a problem that you're having so many tasks to do, then it may be a time to talk to your supervisor, your boss about modifying your workload and seeing what can be done to make it easier. Question assumptions you may have about the situation and keep an open mind about ways to feel better. The same advice we give to our patients. Sometimes it's good for you to take a step back and say, okay, if a patient of mine came with this problem, what would I tell them? Especially for those of us in mental health, because we're always giving advice. What would we tell our patients? And you'll be surprised that when you flip it around, you get solutions. All right, so suggested resources for seeking support. We have the employee assistance programs that are sponsored by the employers that provide you with confidential counseling and other services to help you cope with personal challenges. So those can be a very helpful first resource. And then there are mental health resources that we will share in a later slide. And also we have peer support groups. These are non-clinical groups that can really help you connect with others who are experiencing similar things, and you can learn from each other. So an example would be Facebook groups. There are for like women physicians, they have for women psychiatrists, they have for psychiatrists in general, they have for child psychiatrists in general. So I'm just speaking from my own field, but they will have from other fields as well, I'm sure. So, and they do vet everybody to make sure that they are who they are before they are accepted into the groups. So don't underestimate the power of connection. It's very important to take care of yourself on the job and off the job. Surround yourself with people and places that create a sense of happiness and fulfillment. For some people, it's religious gatherings. Some people it may be clubs or hobby groups. And I'm not talking about clubs where you go and drink all night. You can call your friends or loved ones. You can meet up for lunch, go to the gym, take a walk outside during your breaks. And you can remind yourself of your strengths, your abilities, and your track records for making it through tough times. You can also remind yourself about, what called you into healthcare. And these are more detailed resources available. So I would say this is like one of the most important slides here. Let's make sure you take the picture of it. And we have the NAMI Frontline Wellness Prescription for just a YouTube video that educates you about self-care. We have the NAMI Helpline. We have the 988 Suicide and Crisis Lifeline that anybody can call and text. We have the Physician Support Line, which is for physicians, residents, as well as medical students. We have the Therapy Aid Coalition, which is free therapy for all frontline healthcare professionals. We also have the Emotional PPE Project, which is free for all healthcare professionals. So these are great resources that are available to us. Just to recap, clinician wellness is critical to clinician health, patient outcomes, and healthcare costs. Burnout and compassion fatigue are the biggest challenges to wellness that clinicians face. Setting boundaries, self-care, and seeking support are tools all clinicians can utilize. Exercise, nutrition, and sleep play critical roles to maintain wellness. Last but not least, remember you are not alone. There are many resources available to you in times of need. And I just want to say that, there's some stigma that comes with asking for help, admitting that you need help. But in this age now, I would say since the pandemic, there's been an increased awareness in mental health, and it applies to everybody, not just the patients, but it also applies to us as clinicians. And so we need to be very aware of this and prioritize our mental health, our physical health, so that we are able to take care of our patients. So thank you very much for participating in this webinar. We are pleased to offer one AMA category and of CME, and the instructions are listed there on how you can get them. Thank you again, and open for questions.
Thanks so much, Ori. We'll be sending the recording out, as I mentioned, which will include the links for the CME credits. So please take advantage of that if you'd like to afterwards. And happy to answer any questions that folks have here. You can also directly contact us if you want to follow up on something or have a question that you don't want to ask or have answered in front of the group. And I'll also say that we intentionally are ending at the 30-minute mark here. Hopefully everyone blocked an hour out of your calendars today, and you can use the next 30 minutes to do something nice for yourself with a little bit of space in what I'm sure is a hectic day. I have a question about our contact information. So immediately after we finish up here, we will be grabbing the recording and sending it out. That message will include all of our contact information, so you can feel free to get in touch with us if you'd like then. Any last questions before we give everyone 30 minutes to improve their mental or physical wellness for this Wednesday? All right, it's a pleasure to see all of you. Thanks for joining, and we hope to catch you at our next webinar coming soon. Thanks, everyone. Thanks, Ori.
Thank you.
Bye.
Bye.